Most people in this country are either diabetic, pre-diabetic, hypoglycemic, or insulin resistant, or somewhere in between, and most people don't even know it. And the people that do know it, they don't seem to care. They don't think it's a big deal. But what they don't realize is the three biggest killers of people in the modern world are diabetes, heart disease, and cancer. So to kick things along a little bit, James is going to enlighten you to this important subject. So thanks for coming here today, James. This is probably one of the most common things that most people have and don't even know that they're in some stage of this happening.
Well, I'll start with actually defining diabetes, because this is a very, very common misconception of what diabetes actually means. Because when people hear diabetes, they think excess blood sugar, which isn't necessarily the case. There are sugar forms of diabetes, there's non-sugar forms of diabetes, because diabetes literally means excessive urination. So that's when the biggest symptom you get with diabetes is you urinate more frequently, and that's due to the sugar coming out through the kidneys is going to draw water with it, and so it creates the excessive urination. And that's in the case of sugar diabetes. But the non-sugar forms of diabetes, there's diabetes insipidus type 1 and diabetes insipidus type 2. It involves a hormone called antidiuretic hormone, or vasopressin. If you can't utilize your own vasopressin, or you're not producing vasopressin, you end up with excessive urination. And so therefore there are non-sugar forms of diabetes. So now as far as your sugar forms of diabetes, which is what today's topic, there's various forms. There's type 1, there's type 2, there's gestational, and there's type 3C. So there's actually, again, multiple forms. The most common form will be type 2 diabetes. Now in type 2 diabetes in the early stages, your pancreas works absolutely fine. And in fact, it works a little too much, because what's going to happen, the blood sugar levels are controlled again by insulin, but the pancreas is independent of the brain. So the pancreas directly responds to your blood sugar levels. So as your blood sugar levels go up, the pancreas will start releasing insulin in order to sensitize the cells, which I'll explain that real quick. So say here's a cell, here's a receptor, and when insulin latches onto this receptor, it sensitizes the cell to uptake glucose. So what happens in type 2 diabetes is this receptor is either plugged off from body fat or the fats, or it's closed. And if it's closed, the receptor can't be stimulated to uptake glucose, your blood sugar remains high. So the pancreas is like, oh no, the blood sugar's still high, we need to kick out more insulin. So it starts kicking out all this excess insulin. Now we end up with problems, because the insulin causes a lot of the very serious side effects of the sugar diabetes. Type 2 is the most common form. About 95% of diabetics are type 2. Then there's type 1 called juvenile diabetes, even though it does occur in adults too. And this is where you have damage to the beta cells of the pancreas, where they actually produce insulin. This could be from multiple number of things. In children, most often it's going to be from either autoimmunity, or it can be from giving cow's milk to a child under the age of 2 years old. What will happen is that there's bovine insulin in there. Insulin is a protein, but it's a foreign protein to our bodies. So the body tries to attack this bovine insulin, inadvertently ends up attacking the beta cells, destroying them, and you end up with diabetes. So that's another common cause. Then in adults, it could be anything from infection. It could be something such as what's called alloxin. Alloxin is oxidized uric acid, and that could damage the beta cells on the pancreas. And surgical anesthesia is actually a very common cause. I used to see this a lot in the hospital. Wow. Yeah, people would go in perfectly healthy, going for surgery, they come out diabetic. And so I learned from the nurses at the time that, it has something to do with the surgical anesthesia was triggering the diabetes in these patients. So they go in healthy, come out diabetic. So,
is it reversible?
Type 1, yeah, it can be. It's difficult, but there are ways. They found certain herbs will regenerate beta cells on the pancreas.
So it is possible.
Yeah, it's possible, but not always.
Not likely with the way most people are.
Yeah, that, and it also depends on the cause too, because in something like autoimmunity, very few people know how to treat the autoimmunity, and if you don't treat the autoimmunity, you're going to keep attacking the beta cells. So
I get sometimes these mothers that are very defensive about their child who has type 1, and they're like, it's genetic, they were born that way, there's nothing I can do. Type 1 is not neonatal diabetes. Sure, there are gene mutations every now and then, but that's extremely rare.
I've never seen any evidence whatsoever of hereditary cause of type 1 diabetes. It's definitely going to be physical.
Something that happens after birth?
Yeah, it's going to occur after birth. Again, usually in the case of cow's milk is a big one, but they've also linked a lot of different viruses. I won't go over all of them, but there's I think 4 or 5 different viruses I've seen.
So a weak immune system
Right.
can, invite viruses in.
Infants, you can't just go like start feeding them foods. They do have to have mother's milk.
Right.
That's the primary immune system because infants are not born with an intact immune system. This is one of the big pet peeves with giving vaccines to newborns because the idea of a vaccine is to stimulate antibody response. Newborns do not have the ability to stimulate an antibody response. So why are you injecting newborns with vaccines?
People who give birth cesarean, they have weaker immune systems because they don't get the
flora. Yeah, as the baby's coming through the birth canal, they get vaginal fluids pushed into their mouth, which has beneficial flora, because our intestines are sterile prior to that. And so when they come through the birth canal, it gets pushed into their mouth, they swallow that, that becomes the first flora that inhabits their body. And then it will start to colonize, and over time we get exposed to other bacteria from different sources like soil, whatever, and that builds up our good flora. But if a baby is taken by cesarean section, what will happen is they bypass that. So what inhabits their intestines initially are hospital pathogens. Whatever they're being exposed to in the air becomes their first,
and
whatever.
Plus the junk that they feed the formulas they give these things, which is not even natural anything.
Yeah, the mother's milk is the actual most important because mother's milk goes through changes to meet the baby's demand. So when the baby's first born, you got the colostrum rich, and that's the antibodies, because again, the baby is not born with an intact immune system. They can't mount an antibody response. So they require the maternal antibodies through breast milk in order to maintain their immune system until their immune system can develop, which doesn't fully develop till around the age of 5. And the gut is still permeable to intact proteins up to the age of 2, which is why the cow's milk thing, no cow's milk before age 2. And then the milk will change, and it next goes into a higher fat content, and the higher fat content develops the nervous system. Then it changes again to a higher protein content, and that starts to build the muscle tissue. Then it changes again to a higher mineral content to start building the bones. So the body knows what it's doing. It's just doctors and people. No.
Well, look at the trail of clues. Babies are not born with an intact immune system. They need breast milk for that. But most mothers don't feed breast milk. Type 1 diabetes doesn't show up till around 6 months. So what was the baby getting for 6 months? It wasn't breast milk. It's usually cow's milk and high glycemic baby formula, which is boiled and cooked to death fruit, wheat, dairy, and chemicals. Then they top it off with overly sweet pasteurized fruit juice and yeast and stuff like that. And what does the mother have in her body? If she is breastfeeding, what garbage does she have in her body? Like what is she eating, drinking, smoking, whatever it is that is getting through the breast milk? And the breast milk it's not really filtering the bad stuff out, so it's going into the baby.
Yeah, a lot of stuff will pass through breast milk, including some allergens, so that is important. But still, overall, if you have a choice between breast milk and, let's say, cow's milk or even goat's milk, you definitely want to go.
But I'm just saying, mothers don't really know how to eat and drink and be healthy to create great breast milk for their babies. Like, they don't realize what's all going in there.
Right. Yeah, you want high nutrition, you want less of things, like caffeine, or you don't smoke even, after you give birth. Smoking is still a bad idea because you got stuff in this, cigarette smoke can pass through into the breast milk. So you definitely want to avoid that.
Even the natural ones, there's a lot of people who are in the health who might be taking, that was a question that I get sometimes, is parasite pills and things like that. Does that affect breast milk in the baby?
Depending on what you're taking, like Thujone and stuff, for example, I'd be very, very careful with. Thujone out of like wormwood, for example, or Juglone out of black walnut hull. I'd be very concerned about those passing off through the breast milk.
So wait with the parasite herbs until after breastfeeding.
Yeah, I mean, if it's intestinal parasites, if they're worried about that, they can use the diatomaceous earth safely. But anything that has like an alkaloid or something along those lines, or oils, essential oils that can affect parasites, can very likely end up in the breast milk.
So wait with that.
Yeah. So we got covered type 1 and type 2, and then there's what's called gestational diabetes, which is usually a temporary form of diabetes that occurs from a shift in hormones during pregnancy. So after giving birth, blood sugar will normally go back. It's every once in a while it won't, but in most cases it will revert back to normal. And then there's what's called type 3C, which is not a real well-known form of diabetes. It's also called pancreatogenic type diabetes, which means basically it involves pancreatic itself. So if you have pancreatitis, for example, can lead to type 3C diabetes, or even pancreatic removal. Let's say you got pancreatic cancer and they take the pancreas out. This would be type 3C diabetes. And in that case, you're pretty much reliant on insulin. So those would be the four forms of diabetes.
If you lose your pancreas, you're screwed anyway.
Yeah, you're going to end up on insulin the rest of your life. And insulin is not, I mean, if you can avoid taking insulin, it's a good idea.
I call it the aging hormone. It just ages you rapidly. If you don't, you see, this is what I keep telling people. Anytime people snack all day. Then anytime you eat anything, doesn't matter what it is, you're releasing insulin to some level, unless it's pure fat. Especially women and their carbs. They're just snacking all day. Their insulin level is up all day long. They're just wearing out their body. That's why fasting is so good for you, because you're giving your body a rest.
You're also going to increase body fat, likely if you're eating like a lot of junk food and stuff like that, increased body fat. Increased body fat leads to the insulin resistance, and it can also again lead to type 2 diabetes, because those fats are plugging up that insulin receptor, so it can't do its job.
Yeah, insulin resistance is one of the biggest things that affects so many people, and they don't even know that it's an issue. Like, so many people are affected by that, or some level of insulin resistance. And
well, obesity's gone up big time in the United States in particular, and people are supersizing their meals. They're getting the big gulp.
The irony is with food, there's two things that make it taste good: sugar or fat. And so these sugar-free foods that they have are high in fat. The fat-free foods are high in sugar, or some kind of synthetic sugar sweetener.
It increases your appetite, increases your thirst. Like aspartame in particular will increase thirst, and so they found that what was happening is, even though people were trying to cut calories by taking the aspartame, it was actually increasing their intake of these drinks and foods that have the aspartame, because it was increasing their hunger. So it's vicious cycle there, and that's a very, very powerful neurotoxin. I've heard a lot, there's companies, I was at one of the health expos one time, and they were doing a lecture on these different sweeteners and stuff, and this guy was up there trying to talk about how safe aspartame was, because as aspartame breaks down, we know it breaks down to methanol, which is wood alcohol, very powerful, causes loss of vision, seizures, all that kind of stuff. But he was saying, but it's naturally occurring in fruits and vegetables, methanol, so therefore the small amount of methanol you're going to get from aspartame is safe. What he left out is that your fruits and vegetables also contain another alcohol called ethanol. Now, ethanol is the treatment for methanol poisoning. So that's why you can eat a fruit or vegetable that has trace amounts of methanol and it's safe, compared to aspartame, which doesn't have anything to counter the effects.
Again, you're verifying that plants have everything in balance. It's when you start isolating things that you start getting into trouble. So the same thing with fats. I mean, there's healthy fats. Walnuts are good for you, whereas canola oil, soy oil, all the bad oils, the refined oils.
Yeah, body fat will also plug the receptors. They found something like trans fats, for example, will plug it, but also your body fat can plug it. So that's where it goes to the yes and no part. Like if you're eating a lot of avocado or something like that, that can actually increase body fat.
With the calories.
Yeah, because of the calories.
Right. It's not the fat is bad for you, it's the calories from the food.
Right. So again, moderation.
Yeah, right, exactly.
Even water, you drink too much water too quick, you get water intoxication, swell the brain, kill you. If you were to like chug down a gallon of water all in one shot, you can get water intoxication. It'll cause an electrolyte imbalance. It causes the brain to swell. It can't swell inside the skull, and so it crushes the brain, you end up dead. So moderation.
Exactly. So diabetes is, I don't even want to say diabetes, because that people think, oh, that's just, I don't have diabetes, I don't have type 2 or type 1. But you might have insulin resistance, you might have your insulin sensitivity might be crazy. I used to be hypoglycemic. I put 6 bags of sugar in my iced tea, and I was so proud of it as a kid. In art school, I was like, look at all the sugar I'm eating. But I didn't realize that, like, I had mood swings. I was like so angry. I was so like, ugh. And then the sugar crashes when the sugar's gone, and you're like, you feel like sleeping. So even hypoglycemia is a certain level.
Yeah, there's 2 different primary forms of hypoglycemia. There's acute and chronic hypoglycemia. Your acute means sudden onset. So acute hypoglycemia is also known as reactive hypoglycemia. That's when you eat something and your blood sugar spikes, so therefore your insulin spikes, but it overspikes and drops your blood sugar and you end up hypoglycemic. As where the chronic hypoglycemia would be more along the lines of when you don't eat and your blood sugar drops, and that goes back to the adrenal glands, because when your blood sugar drops below normal, your adrenal glands, if they're functioning properly, will release cortisol, which releases glycogen from the liver, which in turn converts to glucose, raises your blood sugar back up. So there's different forms, and there's other causes, like, again, if you take an insulin shot, you can overdo the insulin, or so there are other reasons, but those are the two primaries.
People say, well, I have to eat all the time because otherwise my blood sugar just goes down, and I think they train themselves that way. I remember when I started fasting, the first day was horrible, but then after 3 days, I became like fat adapted. I mean, my body was living off of fat, which is a great energy source. I mean, I never had any ups or downs and was like running straight and steady. I mean, I was never better off than when I was not eating. And it was eating, my body fat was my energy source. It wasn't depending on this instant quick fix of sugar or bread or carbs or something like that. So these people that say, oh, I have to eat constantly because of the blood sugar issues. Well, that's because you trained yourself that way. Your body's expecting that snack. It's hard to get out of, but it's an addiction. It's a habit.
Yeah, fats are actually the most efficient fuel source there is for the body, better than carbohydrates or proteins.
Yeah.
That's actually an old racer trick. Back in the days, I used to do cross-country bicycling. I did triathlons and stuff. But an old racer trick is you build up to drinking oil. Sounds really weird, but you have to start out slow. Do like a tablespoon, and you gradually work up to like a cup of oil right before the race.
Wow.
And give you tons of energy because that oil burned at a very, very steady rate.
Yeah, exactly.
It wasn't causing spikes and drops.
People nowadays, they do a bunch of sugar. They do like, Gatorade and candy bars. You pay a price for that. When that brick wall hits you, like, you're out.
I'm going to say Gatorade real quick. So there's something interesting about that, because it came up on a board I was on the other day, and I was mentioning about how, because we were asking about what's the most hydrating drink, and I'm trying to explain water is what you really want. And I was explaining about the Gatorade is so high in sugar that it is not good for a sports drink. Yeah. The problem you run into is that if the sugar content goes above a 4% solution, it takes forever to get out of the stomach. Back in my racing days, we used to actually use defizz Coke, of all things, but Coke is 10% sugar. And so if you were to drink it straight, it would take forever. It wouldn't give you any energy because it took too long to get out of your system, and so you didn't have hypoglycemic. So we'd have to dilute it down to that under 4% solution, so it emptied out of your stomach very quickly. So Gatorade's the same way. There's so much sugar in there that when you drink it, it takes too long to get into your system to maintain your energies.
When I go to the gym sometimes I just don't eat at all. I haven't eaten since yesterday. I have more energy to push weight when I haven't eaten since yesterday than if I ate a meal 2 hours beforehand. I'm actually more tired.
Yeah, you're mobilizing your body fat.
Yeah, exactly. So for people who think that they have to eat in order to have energy, you got to get out of that habit. It's a cycle you created. It's a habit. It's slowly destructive over time. And it's better to just give your body a rest. And so any other major things for diabetes?
A little trivia thing that would be very interesting is that you mentioned about the addictiveness of sugar. And there's actually a reason behind that, because sugar in the absence of a protein will stimulate a serotonin response. Serotonin is one of our feel-good neurotransmitters. The presence of a protein that doesn't occur, like Thanksgiving just came by not too long ago, and people think that when you eat Thanksgiving dinner that the turkey has tryptophan, therefore it makes you sleepy. No, it has nothing to do with it. What happens when you eat that much food, your stomach is very, very full. Blood has to be diverted away from the brain down to the stomach to help with digestion. That's what makes you tired. It's the lack of blood flow to the brain. It has nothing to do with the tryptophan in the turkey, because protein will block that reaction, won't allow the serotonin to do its job. But if you take sugar in the absence of a protein, then it will stimulate that serotonin response. Like, your mom would sit there and tell you, don't eat that candy before dinner, you're going to ruin your appetite, which is true. When you took the sugar on that empty stomach, you were stimulating a serotonin response. Serotonin, among other things, suppresses the appetite. And so therefore, when you went to go eat dinner, it's like, oh, I'm not hungry. But as far as the treatment of diabetes, again, it's going to depend on the form of diabetes. With the type 1, like I said, there are some cases that can be reversed. There are herbs that will regenerate islet cells and pancreas. But if it is an autoimmune form of diabetes, then you're going to have to treat the autoimmunity first before you do anything else. If it's something like alloxin damage, or again, you had damage to the pancreas somehow, then there is an herb called Genema sylvestre. Genema is a very common anti-diabetic herb because it's normally used as a sugar blocker.
Yeah.
It has what's called genemic acid in there, which is very, very similar in structure to sugar. So what it'll do is it locks up these sugar receptors. So when sugar comes along, since this is already occupied, the sugar can't latch on. If it doesn't latch onto this receptor, it goes right through the system. Genema sylvester is not only a sugar blocker, they found it also increases insulin sensitivity, and again, it helps with regeneration of beta cells in the pancreas. That is one of the most important herbs you can use for the treatment of pretty much any form of diabetes. There's sugar receptors on your tongue. If you drink it as a tea or take it as a powder, it's going to lock up the sugar receptors on your tongue. So when you go to eat food, you can't taste anything sweet, so your food tastes like crap. And the effects last for about 2 hours. Yeah. So, personally, I prefer to take it in a capsule form, about bypass the sugar receptor in the tongue. So that's the number one. Now, with type 2 diabetes, again, it's the most common form of diabetes, they found that the most common reason for type 2 diabetes is a lack of either magnesium and or chromium. And what these do is that they open up your insulin receptors. So a deficiency of either one of those can cause the insulin receptors to close off to where insulin can't do its job. I've got a ton of studies on my science-based natural healing site that will discuss, they're actually medical studies that I pulled off of PubMed showing the link between chromium and magnesium deficiencies in type 2 diabetes. So I like the chromium and magnesium, but there are different forms. It's very, very important. So like magnesium oxide is the most common form of magnesium you find in supplements, but it's garbage. It's magnesium oxide in the presence of water turns to magnesium hydroxide, which is very caustic and neutralizes your stomach acid, very poorly absorbed. The best form of magnesium is magnesium malate. Yeah, that's pre-acidified, very, very well, better absorbed than citrate. The magnesium malate, I recommend 200 milligrams as elemental magnesium, because they either measure as elemental magnesium or as magnesium malate. So you're looking for that elemental magnesium. You want about 200 milligrams twice a day. And the magnesium also has another benefit because, let me go back to what insulin does real quick. Insulin in normal levels will actually dilate your blood vessels. So in that aspect, it's good. It's when the insulin levels go up high, either in type 2 diabetes or if you're doing insulin injections, you get those sudden spikes of insulin. With an elevated level of insulin, it has the opposite effect. It now becomes a very powerful vasoconstrictor, and this ruptures your micro blood vessels. So in the eye, you get retinopathy. In the kidneys, you get kidney failure, you get gangrene. There's a lot for the damage, heart disease and stuff. So that's insulin damage. What magnesium does, magnesium works very similar to what's called a calcium channel blocker. Calcium constricts muscles like blood vessels, and the magnesium counters that calcium, and so the magnesium will actually relax the blood vessels to improve circulation, so it prevents insulin damage. So that's another reason I like the magnesium. And then magnesium is also required for the formation of insulin by the pancreas. So it has multiple effects.
Yeah, I take magnesium every night before I go to bed.
Yeah, it's great stuff.
Yeah, it is. I love it.
And then your chromium, the form you're looking for there is I prefer chromium polynicotinate, not picolinate. Polynicotinate is 300 times more effective than chromium picolinate. Picolinate's better known because it came out multi-level marketing, so it's really well known, but the polynicotinate is way more effective, same cost. So I prefer that, and that's 200 micrograms, usually 3 times a day is what I recommend on that one. So those are the two most important minerals, and again, I got all sorts of studies on that if people want to read them up. As far as herbs go, there's various herbs that can be used for diabetes. And I already mentioned the genema as being one. I like juniper berry as another one. Juniper berry has an insulin-like effect to it. It will drop your blood sugar very, very rapidly. It's also good for the nervous system, digestion, and so on. I like bilberry leaf, not the berry, the leaf. The leaf has a long-term blood sugar lowering effect. So a lot of your herbs, like even the juniper berry and stuff, it's a very sudden response down. Bilberry leaf, the blood sugar lowering effect can last up to 2 days. Wow. So it's much, much longer in effect. So that's a really good one. Fiber is really good. If you're going to be eating anything that's high in sugar, like with the holidays, coming up and stuff, you're going to eat some pie or whatever. One of the things you can do is increase your fiber intake. Take some chia seed or some other fiber, and what that will do is it helps to blunt that glucose absorption. So it's not going to block it completely, but it does blunt it some. So you're not getting that sudden spike of blood sugar. It's going to be more gradual.
Eat your plants, folks.
Exactly, yeah, that's right, fiber. So that's another really good one. One of the other things I want to mention though real quick that's really important is with this standard treatment for diabetes, type 2 diabetes, I should say, the doctors like to give what's called an oral hypoglycemic drug. That'd be your Diovinase, glucophage, and so on. What a lot of people don't realize is these drugs will actually damage the pancreas in the long term. They blame the sugar because elevated blood sugar over a long period of time can also cause beta cell damage in the pancreas, but oral hypoglycemics are also very well known for causing beta cell damage on the pancreas. This is why when people are on these oral hypoglycemics for long periods of time, often they end up going on insulin in the long run.
It's like antidepressants that make you kill yourself.
Exactly.
It's like the drugs, the heart pills that give you heart attacks.
Yeah, the cholesterol-lowering drugs cause heart failure, and the other thing that really needs to be covered is, again, the side effects of diabetes, because a lot of people, they always attribute it to the sugar. And it's not always sugar. Again, your insulin is what causes the retinopathy, kidney failure, gangrene, a lot of your heart disease. That's all due to the insulin, not due to the sugar. What the sugar will cause the excessive urination, as I explained earlier. It will also cause diabetic cataracts, because as the glucose will draw water into the lens of the eye, the water, again being a solvent, dissolves proteins and pulls those proteins into the lens of the eye, and that causes you diabetic cataracts. And it can raise triglycerides, which there's still debates on that, as how it's involved in heart disease. But those are your primary side effects of the glucose.
Also, just eating too much. You start getting, too many calories of any, even if it's healthy food. You get fat. Mm-hmm. And too much fat affects your insulin sensitivity also.
Yeah, by plugging up the insulin receptors.
Yeah.
Yeah, and the fat thing, there's quite a few different things that can cause that, because it's not always simply as, if you cut back on food, because we hear that all the time. It's like, oh, you're just eating too much. That's why.
It could be your thyroid, it could be your hormones, it could be lots of things.
Yeah, like women go on estrogen replacement therapy and they'll gain weight like
that's
crazy.
the thing we want to talk about in the next videos too.
Okay, so.
Yeah, that's a big one. I get a lot of those. So again, there are no shortcuts. It's not just simply taking something. It's controlling yourself and what you put in your mouth and your lifestyle.
And learning how the body works. That's very important, because there's so much misinformation, especially on the internet, especially when topics like cancer. I get so frustrated with all the misinformation about cancer out there, especially. But again, diabetes. I've even seen doctors who sit there and say, oh, diabetes, that's pancreatic failure. Like, no, it said 95% of diabetics are type 2, which means the pancreas is working fine in the initial stages. And it said working too fine. Is only the type 1 and the type 3C where you got the pancreatic damage, not with type 2 and gestational. So even a lot of doctors do not understand what diabetes is, and it's also why they don't know how to cure it either.
Most of the stuff that we're talking about here, you are in control of. You make the decisions that lead to these results. So keep that in mind. Don't be a victim and say, oh, I'm a victim. There's nothing I can do about it. It's genetic.
One of the things that's hereditary, because a lot of people sit there and say, oh, my grandmother had type 2 diabetes. My mom had type 2 diabetes. So they're inheriting
the diet habits, the food habits.
Exactly. Yeah, it has nothing to do with being hereditary. It's like with, again, cancer. Most cancers are viral. About 95% of cancer has been linked to viruses. But because those viruses can be spread, it runs in families. It doesn't make it hereditary. So with type 2 diabetes, it's those dietary habits. If you're eating a lot of carbohydrates but low in magnesium, low in chromium, you're going to end up with diabetes, or because you're gaining weight because of your bad dietary habits. Again, that can plug up your insulin receptors, cause type 2 diabetes.
Right.
So it is not hereditary. No form of diabetes has ever been shown to be hereditary.
Do the best you can. And even if you can't completely reverse it, you can head in the right direction and make things better and easier for you. You're more in control than you think. Thanks, James, for helping these people. Phytoestrogens, estrogen receptors, blocking receptors, that should be the next thing we talk about, because I get a lot of women talking about these hormone issues, and they're afraid to eat plants because they think that it's an estrogenic thing. So we're going to talk about it in the next video. If you want to, it's almost impossible to get a hold of you. Is there a way to people to get hold of, or do you just not want anybody to bother you?
As I started a site on Facebook, it's science-based natural healing. People can reach me there, post their questions or whatever.
I do get a lot of people saying, "Where's James? I need to ask him. I got a million questions." I'm like, I'm afraid to contact him. He's like, you're going to get overwhelmed with people. I guess you can control if you want to answer them or not.
Well, on the science-based natural healing site, I have another guy on there named Faritz, and I think he's read everything I've ever written in my life, and so he can answer questions as equally as well as me, because like I said, he studied me like to the under a microscope, so he knows all my stuff. And so one way or the other, because I'm super busy with things right now, so yeah, I'm a little hard to get a hold of. That's probably the easiest way to reach me right now, is just through that Facebook for right now, until I can get my med capsule site back up and going.
I mean, it took me 5 years to get him to answer me back. So good luck if you can get through to him. But anyway, so thanks, James. That was really good, really helpful. I hope it inspired some people to help make some changes and hopefully improve their lives. So we got more exciting stuff coming up, more interesting things. Let's talk about female hormones and all that kind of stuff next. So stay tuned. We will see you in the next video. Stay healthy.